emergency. You know, it's like, oh no. It's like, put on your seatbelt. It's like, okay. So I am headed to the hardware store. I was gonna say drugstore because normally I'm there often. Um, but no, I'm trying to get some work done on. Good thing I checked the weather. Low though, I'm going to make the call to stay over at the apartment tonight because I don't like going outside when it's cold. Um, and I was already kind of tardy coming over here this morning. Luckily, my brother was still here and he was eating probably second breakfast by now. I don't know, first breakfast. And I got a chance to, look at his bedding so I can put something underneath there because I had some stuff at my house that could help him be more comfortable. All right, and so now I'm heading to the hardware store to get more stuff for my home and situation. All right, and while I'm doing that, I'm going to tell you about integrative health versus allopathic medicine. Okay, first, the terms. Now, a lot of people have heard of the word holistic. Like, people use it to the point where it's just in everyday language, right? Oh, holistic, holistic. You know, those who are in those kinds of worlds, they use that language a lot. But I wonder if people really know what that means versus its opposite. So I'm going to tell you what the opposite is so that you can know itself means. Allopath is the term for, how could I say, diagnosis of diseases and conditions that are unfavorable to the body. Okay, it's the opposite of being well. You're sick, basically. And then the study of it. Sorry, I'm just being nosy too because they just threw up this housing, and I'm like, there's nowhere to park. But anyway, so it is the way that people find out who's ill, who's not, in treatment of all of that. So that's allopathic medicine. Excuse me. And it's targeted directly to diseases and maladies of the body. Okay? They don't necessarily look at the body. I know that sounds weird. They look at the disease. They look at the condition that makes things unwell, like the sickness, like the bacteria or the virus or the injury that may have caused the malady. Okay, the tumors, so all of those kinds of things. So that's allopathic medicine and field. But if that is the case, then holistic means looking at the entire body, lifestyle, and environment. There is now, it's not new science, but now more people are talking about epigenetics and junk DNA and how your environment does contribute to, things like cancer. Think like that's the most perfect thing. So some people say, smoking causes lung cancer, but so also pollution. Okay, like pollution that is in the air. If you live next to like those factories that have like, smoke stacks and stuff like that, then you're over time going to develop a cancer because epigenetically it's damaging your body, because every time your body tries, and it does, regenerate itself or grow. That's the other word I like to use. I like to say regenerate because that's what we do. We regenerate ourselves. It doesn't mean that we're going to be new, but it means we have another copy of ourselves over and over, and our copies degenerate. That's, I guess, what aging is. But at every regeneration of yourself, intermingled with the harmful, let's say again, pollution into your body, it is now, it's not, it's not chipping away at your cells as like some people like to think of it as. Is more like integrating into your cells and damaging the process of making new versions of yourself that should be strong and healthy. So that is what the environment, harmful environment, would do. And then, yes, people talk about scar tissue, especially, let's go back to the lung cancer thing, scar tissue and things like that. Yes, you can even kill off cells eventually, the ones that could help you regenerate. So aging really is super over oxidation of your cells to the point where you cannot regenerate yourself. Okay, that's natural aging and eventual death. Is when you just, it just keeps copy without all of the necessary things that it needs to regenerate itself healthy and strong. My day is doing well. Yeah. So when I tell people that I'm 50 years old and they look at me like, what? I thought you were 30. I was like, no, honey. It's because I, I mean, I like the phrase, but I don't like it. When people say you take care of yourself, but really, yeah, I'm being mindful of the things that could cause me, and this is not vanity, cause me not to look 50 years old. So I don't know what that means in certain people's worlds, what they expected 50 to look like. But my way of 50 looking like 50 is what I look like. That's what I look like, okay? And part of that is being aware that when you eat food, food is a nourishment. It's not to stop your stomach from growling, okay? In the last 100 years, that's where food science has really, and I'm going off on a tangent now, sorry. So where food science has tried to solve the problem of starvation. Really? Yes. So food science, last 100 years or so, is wanting to stop starvation. And so they're not necessarily trying, I mean, now there's some people doing that, but they're not necessarily trying to look to improve people's bodies and lives rather than just stop their stomach from growling. I think more and more people are starting to get hip to it, though. And then with that, when you put, and it's sad to say that I have to use this as an analogy, gas in your vehicle. When you put the good stuff in your vehicle, it runs better. The same is true for your body. When you put the good stuff into your body runs better. It just does. Okay? When you treat your body not on the outside, it's like, I thought about it too, because I'm still part of that natural girl, whatever kind of thing, where I make my own stuff, a lot of it. I don't necessarily want to go buy fruits and vegetables to slather on my skin and on my hair. I'd rather eat it because it helps from the inside out. Okay? I don't eat Cheetos and then decide to go put on like a papaya mud mask or something on my face, go buy a papaya and put it on my face when I could have been eating it, right? That's the vitamin C that you need and the fiber. But then I go around eating Cheetos. That make sense. Yeah. So I'd rather eat the papaya, okay, than put it on my skin. Or, that kind of stuff. So epigenetics, let's go back to that. So epigenetics will affect your cells, okay? And when it comes to allopathic medicine, they kind of think about that kind of stuff a little bit. Like that's why they tell you to do things like stop smoking. That's the only thing that they can tell you: stop smoking and stop eating bad food, right? Um, because they are thinking about it, but they're not being as preventative as they could be, only because that science and that um, perspective of health wasn't really focused on. It was more on get the disease, attack, attack, attack. But what about what makes a body its optimation, like optimal prime? What makes that body perform at its tip top best? And I guess until we started having a branch of medicine, like sports medicine, when people wanted like the super athletes, that people started thinking more about that. Okay, it's very ironic. It's like, I would say, if I had to give anybody some advice, don't train like an athlete, develop your health like an athlete. Okay, like not to push yourself, strain yourself. So that's the other thing. Athletes are okay with stress because they also, that's a part of their job, what they do. But if your life is already a stress, why are you extra stressing yourself? Things like boot camps. Like, I hope in 2026 people stop trying to jump on like these people's training who say, oh, let's do a boot camp, and then they can't move the next day because their body has been like busted from the stress, and they paid whatever for a package to get somebody to whip you in shape, because everything you think about is like this, like this, like this. Your health is not like that. Okay, like, again, when people become overweight, there's a process that happened there. So why do you think you can be overweight just like this, like this, like this? you know and before I go, I'm gonna try to make this short. Integrative is also the same, I guess, same difference with holistic. I think integrative is more making use and being more aware of, yes, the the disease and the wellness of your body, the optimization. Okay, it's how to be healthy. It's how to be healthy. So it's more than just, think about it. Okay, this, we've been hearing it, but we don't actually live it. In that, people say an apple a day keeps the doctor away. Yes, that's true. um Eat right and exercise. Yes, that's true. um but nobody goes more into like that detail. It is becoming more and more useful. I want to do a series on folk medicine, and I say this because, yeah, I was at a party about a week ago. Was it a week ago? Yeah, it was like a week ago. And yeah, that's where, again, I was telling people about my brother, and they were asking, some people knew. And the guy was asking me, he was like, well, how old is your brother? Are you older or younger? I was like, well, I'm older than him. He's 48. The dude was like, what? He was like, excuse me? I was like, yeah, I just turned 50. He was like, what? It's like, you look like you're 30. I was like, yeah. So, and then I was end up talking to somebody else who I know, about folk medicine, about how, at least in the United States, they made a concerted effort to get rid of folk medicine. Now, I also am aware of the history behind charlatans and all the other things, like people who basically did the snake oil stuff, but not all of it was like that. Okay, there were some who were out there trying to be the superstar, rock star, doctors or whatever, door to door, selling you a little potion kind of thing. Yes, there were those folks out there, but then there were others who were practicing folk medicine, and they were successful at it, and they, not to say that they were doing it to make a living, but that was their calling. Okay. And I think we need to have that. And I think I mean, we do think about it. We have health food stores. Um, the ones that I like to go to are only open like maybe 2 days a week now because they are so popular. Because when I went in there the last time, people come in and they ask the clerks. It's like they're not just selling that stuff. They know this stuff. Okay. And I, when I go in there, I know what I know, and I look for what I'm looking for, but sometimes people go in there, they're looking for advice. They're looking for help. They're looking for, well, what do I do if I have this? What do I do if I need, so it's not just selling the stuff. And maybe eventually I could be like, I don't know if I want a health food store. I mean, it's something to think about. I don't know if I would have something like a tea shop or something like that. I don't know. It's something to think on. Or if what I would offer would be something more virtual, maybe. But my book has to come out first. So there's that. I got to get my book out. Okay. But in the meantime, you can like and subscribe. And, if you have questions about health and wellness, I'm sure I can help you. Like a lot of the things that people say is so simple, but it's hard. Um, and I will say, I'm working on detoxing. It's been a while since I had a detox, only because of the situation with my brother. It can be really difficult when you're trying to be a caregiver, right? I need a detox. Like I can tell from the congestion. I have things I can do for this, but actually there is no but. I'm gonna tell you now. Okay, I can work on clearing up my congestion. I have a protocol for that, and it's not necessarily hard to do. I just have to remember to do it. It does take for me to, yeah, I could totally do that. Yeah, and I think the other thing that ended up happening, I did try to do it. Something happened with my ear, so that was the other issue. So I'm going to try it again because this is also the time of year where I might end up getting things like a sinus infection or an ear infection anyway, and I definitely need this cleared up. So I'm going to work on my protocol. If you're interested, I could probably have it available. It's not hard. The only difficulty is timing, and even that's not difficult. If you practice intermittent fasting, it should not be a problem. So yeah, so clearing up a lot of the mucus and the congestion here. But like I said, I can't beat the elements if there's dirty air out here. I mean, there's only so much I could do. But once it's in me, I can get rid of it though. Okay. All right. With that, we'll say take care. Have a good one. Um, like I said, like and subscribe. My book. I gotta get it going. It's gotta start happening. Um, but yeah, take care out there. Practice holistic wellness, folk medicines and remedies. Maybe I'll come back on later, talk about some how it makes me feel bad when people try to use allopathic methods on holistic remedies and then they say they don't work.